Regenerative medicine is one of the fastest growing fields with new papers published every single day. As a busy mom of two, I am guilty of not making time to keep up with the research, and I think a lot of other veterinary professionals are in the same situation. My name is Dr. Adrienne Wright, and welcome to Sit, Stay, Learn, a short podcast where I review regenerative medicine uses in veterinary science. So each episode, I break down a paper, and then we spend 10 to 15 minutes here just giving you the details that you need to know to feel like you're staying on top of the research. This paper was an interesting perspective article that I came across on my LinkedIn feed a few days ago, and I recognized one of the authors, Dr. Katsia. He was the department head at Kansas State College of Veterinary Medicine in the Department of Anatomy and Physiology while I was in graduate school. I have had the pleasure of attending a few of his seminars, and he does fabulous work in the pain detection space. So I immediately wanted to give this paper a read. This paper, titled Outcome Assessment in Veterinary Pain Studies, a Pain in Animals Workshop or PAW Perspective, was published in Frontiers in Pain Research in April of 2025. This is a slightly different paper from what we normally cover because this is a perspective paper, but it's from the viewpoint of Pain in Animals Workshop, or PAW, as we will refer to them from here on. This is a meeting that's held every other year in partnership with the NIH, and pain, in my opinion, is the root of why we do what we do. So keeping up with the research, the opinions from the leaders in the space, etc., is so important, especially for me as a leader of a regenerative medicine company. So, like I said, pain is at the root of why we do what we do. Reducing pain and discomfort is the end goal, but doing it in the best way possible is at the forefront. So regenerative medicine is more than just masking the pain. It's trying to address the underlying cause of that pain. But more than that, understanding the pain allows for better R&D. Knowing how to measure pain would be the holy grail. The simplification of clinical trials for therapeutics would be huge. And that's not to say that the veterinary market has not come a long way in a short time. It's just that there is a push for knowledge gain in the pain space. And when you set up the history of pain management in animals like the authors did here, it really is amazing to think how far we've come in 2 decades. So here's the problem. How do you know the animal is in pain? Well, I would start with saying mobility issues like limping, maybe difficulty jumping on the furniture, slow going up the stairs, but there's also behavioral signs. So what about aggression, or on the flip side, excessive affection, hiding, withdrawal? They may have altered posture, or they can try to vocalize their pain with whining and whimpering. They may have a loss of appetite, decreased activity, licking and biting of that painful area, shaking, panting, the list goes on and on. But here's the thing, it doesn't look the same in every animal. And I'm not just saying like, okay, cats versus dogs, but even one dog to another. And there is no definitive thing that says, yes, this is pain. For example, my dog shakes during storms and she whines to go outside. Those are not pain. Those are other feelings, other stresses. And the biggest question that a true scientist would understand me saying is, how can you even begin to quantify that? So the double-edged sword, in my opinion, of a clinical trial is that you have to prove effectiveness in a quantifiable manner. This is so beautiful, yet so frustrating. And it makes therapy development really hard. For example, with our osteosarcoma clinical trial, the outcome was really simple. Has the cancer spread? Yes or no? That is your disease-free interval. That's the unit of measure. And that's what we looked at. But then let's look at OA. How do you measure effectiveness of OA treatment? You're probably thinking pain reduction. Bingo. But again, we go back. How do you quantify pain in animals? Especially when they cannot tell you what pain level they're in. So this is where the focus of pain measurement and understanding really comes from. I love that this review or perspective, I guess, they start with a really nice review. So let's dive into it. You have Rimadyl, that was approved in the U.S. as the first NSAID for pain relief and inflammation associated with OA in dogs back in 1996. The effectiveness of pain was evaluated using 1, the veterinarian's assessment of pain and function, 2, an owner's assessment of pain and function, and 3, a gait analysis. 2 decades later, there are still the same primary approaches used for the assessment of pain of OA in dogs. So this may suggest lack of advancement in the area, but as the authors suggest, this is not true. Advancements like the pain in animals or PAW workshops in conjunction with the NIH have brought awareness and fostered innovation to the pain area. But that Rimadyl approval spurred a lot of movement in the field. Several additional NSAIDs were approved, but there were also educational campaigns on how to recognize chronic pain in dogs. Veterinary practice changed as mindsets of the owners shifted. Like the authors note, your owners were no longer coming in and saying, oh, I think this animal is slowing down because he's getting older. But now they're saying, hey, I think my dog may have osteoarthritis. These changes were also seen in research. Research shifted to being able to use the owner's assessment of pain in their dog as a tool. And getting to that point was not easy. The owner's assessment of the dog's pain is the primary reason that the dog is being seen. And the owner is how we determine how that pain is being managed. But for studies to have reliable and valid assessments to be used in research was a huge hurdle. So let's discuss this a little more. So the first objection was that pain is subjective and subjective things can't be measured. Well, that's not true. Clinical metrology instruments, or CMIs, are meant to measure subjective health states, and they include things like psychometric testing, construct validity, and internal consistency. These concepts are mainly from human psychology, and they really had not had a presence in veterinary medicine, and few practitioners knew about them. You add to that the requirement for veterinarians only to review papers going in main veterinary journals, and you can see where this lack of knowledge and understanding of CMIs in the vet space comes from. The second objection, that patients cannot speak. The human field relies on the pain scale that we all know. On a scale of 1 to 10, how would you rate your pain level? But animals cannot self-report. But what about children or cognitively impaired individuals? They also cannot self-report, and they rely on caregivers or parents to assess this using observer-completed assessments. These tools are based on the idea that an observer can evaluate the impact of pain via a global assessment using things like facial characteristics, body posture, function, and even movement patterns. We know that pain interferes with activities of daily living, so a knowledgeable observer really could reliably rate changes that you see in behavior. And I think that changes in activity are interesting because a 3 may impact function for some, while it may take maybe a 6 for others. So similarly, what I would say is a 5 on my pain scale would undoubtedly be different to other people. And the third objection, owners are not trained to observe pain. Well, veterinary professionals are easily the most experienced experts at understanding behaviors of animals that are in pain after surgery. However, chronic pain is a different thing. Chronic pain, like you see in OA or even cancer, maybe oral pain, those impacted behaviors are shown at home. And we now understand that animals are different in a clinic environment. They're excited, they're stressed, they're distracted, or what have you. And this is going to make those altered behaviors really difficult to note if they're noticeable at all. So there is the thought that the owners who observe these behaviors are the most knowledgeable observers, and that this makes them an invaluable tool to the study and the understanding of chronic pain. But the focus on owner pain assessment has brought new questions to light. So the particular incident that the authors bring up was when someone asked the question following a presentation on the validation of the Canine Brief Pain Inventory, or the CBPI, and asked, which is better, your instrument or gait analysis? And as you can imagine, this allegedly sparked a heated debate on which is better, subjective versus objective, etc., etc. And I think that's never the question, in my opinion. There is no superiority. In something like OA, they all play a role in assessing the severity of the disease. And the authors bring that up, that different tools measure different things, even within a single dimension or domain like movement that is impacted by pain. Gait analysis, which measures the ground reaction forces, is the gold standard for measuring lameness. So if measuring lameness is your study outcome, then that's probably your better option. But in my opinion, that is not to say that CBPI could not play a supporting role in your analysis. But if the study goal is to understand how pain is impacting the ability of the animal to function, then a pain assessment would be the logical choice. But I love how the authors phrase it here. It is never a which is better question. It's a what measurement or outcome makes the most sense for my study. The more proper comparison, which they highlight quite nicely, is the CBPI and the Liverpool osteoarthritis in dogs, or LOAD. LOAD is another owner-completed questionnaire. It's validated for use in dogs with OA. But again, they are a similar tool, measuring two different things. CBPI asks about the severity of pain and the impact on those daily activities, while LOAD is looking more at mobility in general and in relation to exercise. So, although they're correlated, they may perform differently in different populations. Moral here is that there is no perfect tool to use in every situation. Every study will be different, and I absolutely love this line from the paper. Chronic pain is a multidimensional, complex condition that varies based on the underlying disease and the population being evaluated. So, because of this, we need multiple valid and reliable tools if we ever want to help animals suffering from chronic pain. So, in terms of PAW, this group meets every other year. They have two main objectives. One, to advance veterinary medicine, and two, to advance translational research, which is really what we all want at the end of the day. But this group is driven by the fact that pain, specifically chronic and persistent pain, is one of the most poorly understood and underdiagnosed conditions in animals. I would even go as far as to say it's probably similar in humans as well. But the second driver is the lack of translation of basic research into new and approved therapeutics for the treatment of pain. As someone from Eastern Kentucky who witnessed firsthand the opioid epidemic in my own family and community, pain management is a concern that I personally care about. So they cover some of their meetings. The first one, I believe, was in 2017. They had one in 2019. Like I said, it goes on every other year. But in the first meeting, those priorities included additional reliability and validity testing of currently available CMIs, SOP development for the appropriate use of CMIs, and 3, optimal study design using the CMIs. The good news here is that there has been a lot of activity in the form of publications that are directly related to that first priority. But 2017 also included discussions on gait analysis and activity monitors. And when you talk about something like an activity monitor, there is a real need for the development of metrics around what it means for clinically relevant improvement and understanding how to use those activity monitors that are currently available. I think activity monitors are super promising. I believe that dogs suffering from OA have less activity. And to strengthen those owner assessments, an activity monitor makes absolute sense. And with advancements in AI, I feel like this is really a slam dunk. But from paw efforts, there's also a publication highlighting the best practices of gait analysis, which those are always useful. 2021, interestingly, that workshop included the concept of biomarkers for pain, which is a huge interest of mine. A lot of my doctoral research focused on extracellular vesicles, and although I consider them as more of a therapeutic tool from my perspective, their understanding as disease biomarkers or even pain biomarkers would be the holy grail. Again, a direct link to AI here and machine learning. So for that potential diagnostic, there's already a lot of activity in the literature about this, so that's pretty encouraging. But the author's discussion of translational research was truly my favorite part of this paper. How they simply put it into perspective is so eloquent. Pain conditions, especially in humans, is a major public health concern. It has individual, societal, and economic impact. Looking specifically at chronic and persistent pain, the current practices of translational biomedical research is failing to produce novel therapeutics, despite the clear need. They even quote a powerful statement. Despite generating a plethora of novel analgesic targets, pharmaceuticals for chronic pain treatment remain largely limited to the same 6 drug classes as present 40 years ago. Wow. So when you sit back and consider that point, it really is eye-opening. So why is translational medicine failing? A question where everyone has an opinion. And I don't think that there is a single answer. I think it's a lot of factors playing a role. But as the authors argue, one of their main reasons for the failing is the need for improved, validated, clinically relevant models to measure pain, which I would agree with. Most of the models used now are induced. They're induced to model the target clinical conditions. And as they state, this has worked well for us to understand disease mechanisms, but it's not seemed to work for selecting new analgesic drug candidates. And in my opinion, induced disease models also come with moral concerns. So in a world where inducing unnecessary pain and suffering is getting more attention and being seen as a real negative piece to R&D, I think that pushes alternatives to be needed more now than ever. So there is a call for spontaneous disease models, especially in non-rodents, which I fully support, and it does seem to be a paw focus for future meetings. On the flip side, spontaneous models come with their own challenges. So you lose consistency of the induced models, you introduce other variables like epigenetics, environment, age, etc., which can be tough from a controlled experiment perspective, but I believe that's what's needed because it may more accurately capture the population variability you would see clinically. Overall, I think this was a really insightful article. It left me with a lot to think about. What are your thoughts? I would love to hear them. And please keep requesting copies of these papers and sending me papers to review. I want to help you feel like you know and understand the science that is being put out there. So for the text version of this episode, you can head to our blog. If you have questions on this episode or a paper you'd like for me to review, please email me at adrienne@ardentanimalhealth.com. I hope you all have a wonderful week. See you next time.